When Clomiphene was discovered, there was a lot of joy amongst women and their doctors, because we knew that Clomiphene is going to solve fertility problems. Women are now going to be pregnant at any time they wish. However, misuse of Clomiphene has brought health hazards, and women are now suffering from side effects of Clomiphene. In this video, let's look at how it can properly be used, its side effects, and how we can overcome those hazards, problems caused by Clomiphene. Don't go away.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. And I told you, if you'd like to get in touch with me, to have a private chat, because some of you fear putting your questions there. But if you have a private chat, you want a private chat, go to my website and book an appointment. It is www.drothman.com. Book an appointment. We shall discuss and probably find a solution to your problem. And if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important update we make. Now today we are talking about Clomiphene, what most of you call Clomid. Clomiphene. What is Clomiphene? And why are we talking about it? I told you that Clomiphene is one of the wonder drugs in fertility management. Actually, when it was discovered, many women, doctors, fertility experts were happy about the discovery, because we knew that it is going to solve the problems of fertility. And indeed, it does. However, it's now becoming a monster. It's becoming a deadly animal because women misuse it and they end up with health hazards, health problems. So, what is Clomiphene? Clomiphene, or it's called Clomiphene citrate, it's a medicine that is given to you, and it stimulates the release of follicle-stimulating hormone and luteinizing hormone to cause maturation of an egg, and also causes ovulation for you to conceive. That is Clomiphene, and that is its purpose. Now, what Clomiphene does exactly, the mode of action, how it does it, it triggers the pituitary gland. Once the pituitary gland is triggered, there is stimulation of the gonads to release the follicle stimulating hormone and then luteinizing hormone. By looking at its mode of action, or how it facilitates ovulation and the development of the follicle, you can now understand when do we use it. Now, there is a problem here. Many women just use Clomiphene anyhow. When you spend 2 years, 3 years without conceiving, you go to the pharmacy, buy Clomiphene and swallow, and you think your fertility problems are going to be solved. And even some of us doctors, a woman comes, has spent years without conceiving, the doctor will tell you, get Clomiphene, start using Clomiphene. This is very wrong. Clomiphene shouldn't be used like that. It should only be used when it is required. Not that all fertility problems are solved by Clomiphene. No, Clomiphene only solves one part of the fertility problems. So where do we use it? Actually, before using Clomiphene, make sure that you have done tests and found that it is Clomiphene that is needed, or the problem is with the follicle-stimulating hormone or luteinizing hormone. Now, what you're going to do, you are going to do a fertility hormonal assay. Your doctor should be able to do a fertility hormonal assay. Identify the levels of luteinizing hormone and follicle-stimulating hormone. If we find that luteinizing hormone is low, or follicle-stimulating hormone is low, or both of them are low, then we shall give you Clomiphene. Because we know that Clomiphene triggers the pituitary gland to cause the gonads to release follicle-stimulating hormone and luteinizing hormone. Therefore, if the reason as to why you are not getting pregnant is because of the low levels of follicle-stimulating hormone and luteinizing hormone, it means we shall give you Clomiphene. Now, you are the right candidate to receive Clomiphene. Also, if we find that estrogen is high, the levels of estrogen, because we need estrogen, but if it is very high, now you need clomiphene. Why? Because clomiphene blocks estrogen. It blocks estrogen. Once estrogen is blocked, then there is stimulation of the release of follicle stimulating hormones. Now, how is clomiphene used? How? You must understand how we are going to use this clomiphene. Because again, some people, you may find that the indication is okay, the problem is very right, it is clomiphene that is needed, but they use it wrongly. This is how clomiphene should be used. You are going to use 100 milligrams daily for a period of 5 days. Now, most of the drug formulations of clomiphene come in 50 milligrams. Therefore, you'll be able to take 2 tablets every day for a period of 5 days. However, someone can decide to take 1 times 2 or 1 every 12 hours, though some people can take 1 tablet daily for 5 days. As long as, can take 2 tablets daily for 5 days. It's as long as you've taken 100 milligrams of clomiphene, then you're good to go, and should be taken for 5 days. The biggest question is when? When do we take clomiphene? This is where there is also a very big problem. You will find that most people will tell you that take clomiphene on the 50th day of your menstrual cycle. Take clomiphene on the 50th day. Actually, most people are taking clomiphene on the 50th day, on day 5 of their menstruation. It is okay to take it on day 5, but it is not that. Not all women will take it on day 5, because women have different length of their menstrual cycles. I am telling you, I have found several people giving women clomiphene to be taken on the 50th day. Now, let us take this example. If the length of your menstrual cycle is 21 days, and you're going to take, because with the length of the menstrual cycle being 21 days, it means that your ovulation day is on the 7th day. Now, if you're taking clomiphene on the 50th day, it will mean that you will even ovulate while still taking clomiphene. Now, what is the use of taking a drug which will not facilitate your ovulation? Because it is taken for 5 days. Now you've taken it on the 50th day. It means you'll be finishing these drugs on the 10th day. You'll have ovulated, if possible, on the 7th day. That is misuse. And that is how many people end up failing. They fail to get what they want out of the clomiphene. So, this is the trick. Clomiphene is taken 3 to 5 days before your fertile days. 3 to 5 days before your fertile days. Therefore, a person who takes clomiphene on the 50th day is that person who has a cycle of 28 days. A regular cycle of 28 days. If a person of a 30 days cycle, you will not take clomiphene on that day. What you're going to do, you are going to calculate your fertile days. Count 5 days before your fertile days begin and start taking clomiphene. I talked about how to calculate your fertile days, ovulation day, when you have an irregular menstrual cycle, or if you have different length of your menstrual cycle. So, check out that video, understand how you can calculate when your fertile days. Then, start taking clomiphene 3 to 5 days. Actually, in most cases, take it 5 days before the beginning of your fertile days. That is the best way of taking clomiphene. It shouldn't be like a gospel, or it shouldn't be like the lines we find in the Quran that the way it is the way it's supposed to be. This is very different. Every woman is different. Their periods vary. Therefore, take your clomiphene very well. Now, what are the side effects of taking clomiphene? These side effects can be even when you're using clomiphene very well, but in most cases, it comes as a result of misuse of clomiphene. Flashing. Most women, after taking clomiphene, they get redness of the redness of their skin on their face and so on, and that is one of the side effects of clomiphene. That is minor, and if you develop it, you shouldn't worry because it will disappear after a very few days. But the most important, the most dangerous side effect is called ovarian hyperstimulation. And once this occurs, you are supposed to stop the use of clomiphene when there is ovarian hyperstimulation. What are the signs of ovarian hyperstimulation? Because someone may not know what that is. With ovarian hyperstimulation, a woman will get abdominal bloating, will get a gassy abdomen. Then you will have nausea, and sometimes people vomit. Then others will even have diarrhea, lose stool every time you want to poo, because of that clomiphene. Now, the worst side effects are difficulty in breathing, chest pain, and difficult urination. Actually, this becomes an emergency when someone develops dyspnea or difficulty in breathing, chest pain, and then failure to urinate. These are signs of ovarian hyperstimulation. In case you get those signs, in case after taking clomiphene, maybe 2 to 3 days, or even on the first day of taking clomiphene, you develop difficulty in breathing, there is chest pain, you're failing to urinate, you're having abdominal bloating, then you should call your doctor, understand that this may be ovarian hyperstimulation, and you will need to be treated with urgency. And the first thing to be done is to stop any further swallowing or taking of this medicine. Another side effect here is blood vision and double vision. Actually, when women take clomiphene, some of them will develop blood vision. They will not be able to see very well. They can see two people. Like there is one person, your husband comes, and you're seeing two people. You're seeing two husbands instead of one, and that can be a sign that clomiphene is not doing well with you. So with vision, you can have a blood vision, and you can also have a double vision. When these signs occur, also the blood vision and the double vision, you should stop the use of clomiphene. Another feature is moodiness. When some women take clomiphene, they become moody all the time. They are moody. They develop mood swings. They are moody. And when this sign happens, you should know that it is likely to be clomiphene. But this shouldn't worry you, because as the medicine gets out of the body, you stabilize. Now, other signs can be breast tenderness or pain in the breast. This is some minor sign. Headache. It's also a minor sign, but it is there. Then vaginal dryness. Some women become dry after taking clomiphene, and also some studies have shown that women can develop cervical. There is decrease in cervical mucus production. So the cervical mucus decreases, the production decreases because of taking clomiphene. And lastly, on the side effects can be multiple gestation. However, this can be very good to some women because when some women take clomiphene, they end up releasing more than one egg, and then fertilization occurs, and you'll have twins, triplets, and so on. That is also a side effect, but to some women, it is a desired effect. Now, who is not supposed to take clomiphene? Everyone, listen to this, listen attentively. And if you have a friend who is just taking clomiphene anyhow, share this video with that friend. And if it's your very first time to watch this video, to watch this channel, please don't forget to subscribe. Also press the notification bell in order to be notified of any important updates. And I told you, if it's your very first time to watch this channel and you would like to have a private chat, a private consultation with me, go to my website www.druthman.com and make an appointment. We want to look at the contraindications. Who is not supposed to use clomiphene? Once you have any of these, don't tamper with clomiphene. Don't bother yourself taking clomiphene. So these are the people not supposed to take clomiphene. Blocked tubes. If a woman has blocked tubes, why are you taking clomiphene? When we are talking about fertility, in fact, we said that in blocked tubes, remember when the egg is formed in the ovary, during ovulation, it is released into the fallopian tubes. Then the sperm is supposed to swim through the uterus, enters the fallopian tube, and fertilizes the egg. Then the zygote is supposed to be propelled, moved through the fallopian tubes into the uterus. Now, if your tubes are blocked, it means the egg will not be able to pass. Or if the sperm will not be able to pass through to meet the egg. Therefore, fertilization cannot occur. Now, even if you take tins and tins, 1,000 tablets of Clomiphene, you will not conceive, because the eggs will be formed, ovulation will occur, sperms will be bad, will be stopped from meeting the egg. Therefore, you don't need to use Clomiphene when you have blocked tubes, except if you are going to undergo IVF and there are preparations by the doctors about IVF, then they can give you maybe. But if it's not that, don't use Clomiphene when you have blocked tubes. That is the reason why I said before using Clomiphene, first get facts right. First do tests to identify that really the problem is the luteinizing hormone or follicle-stimulating hormone for you to take Clomiphene. But blocked tubes, nada. Now, fibroids. If you have fibroids, you don't need to use Clomiphene, because what is stopping you is known. Then there are women with thin endometrial linings. There are women with thin endometrial linings. So a woman with a thin endometrial lining is not supposed to take Clomiphene. Now, there are people, you find that you're failing to get pregnant, but the reason as to why you're not getting pregnant is because your man doesn't have motile sperms. There is male infertility. The problem as to why, the reason as to why you guys are not conceiving, it's the man, it's your spouse, not you. Therefore, why are you taking Clomiphene if there is male infertility? That's why you must first do tests before taking Clomiphene. Please do tests. Please do tests before taking medicines. Now, if a woman has low ovarian reserve, you don't need to take Clomiphene. Low ovarian reserves, no Clomiphene is needed. What you need to do is to take supplements, those medicines, the Depo-Provera, the methyrodoxahydroprogesterone, those medicines that will help you to regain your reserve, to have a moderate ovarian reserve. So you don't need Clomiphene there. Now, there are hormone reactive tumors. Hormonal reactive tumors. Hormonal reactive tumors, because there are people who have tumors or masses, or call them cancers, that are reactive to hormones. Now, if that tumor reacts to Clomiphene or follicle-stimulating hormone, it will cause the extended growth of that tumor. Therefore, what I'm meaning here is that there are some tumors, masses, or let me call them cancers, but I'm trying to mean a mass or a growth. I'm trying to mean a mass or a growth. There are those call them swellings. Very good. I've gotten a good one. Swellings. There are those swellings that need Clomiphene for them to grow. Now, if you have that swelling and you take Clomiphene, you're going to increase its size further and you escalate the disease. Also, there are women who react to Clomiphene. If you've ever reacted, for example, you had ovarian hyperstimulation, you had those serious problems, blood vision and double vision after taking Clomiphene, then you shouldn't bother taking Clomiphene. Just know that your body reacts to Clomiphene. Try something else. Discuss with your doctor, try something else. Now, for those of you who are supposed to take Clomiphene, where Clomiphene is indicated, what are the different brands of Clomiphene? I know most of you only know Clomid. Everyone is talking about Clomid, but there are very many other brands of Clomiphene. There is, of course, Clomid, there is Ovulex, there is Cerophene, there is a brand called Cerophene, and then there is also a brand called Mirophene. There are several brands, so don't stick to one brand. There are several brands of Clomiphene, and they all contain that substance called Clomiphene. However, now, for those, because there are people who are reacting to Clomiphene, what else can you use? In case we find that the problem with you is the low luteinizing hormone, low follicle-stimulating hormone, or high estrogen, what else can you use if you cannot use Clomiphene? For example, you reacted to Clomiphene. What else can you use if it's not Clomiphene? So the alternatives to Clomiphene, you have a drug called Letrozole. You can use a drug called Letrozole. There is also a drug called Raloxine. Raloxine is also a drug of choice in case you cannot use Clomiphene. And lastly, a drug called Tamoxifen. Tamoxifen. It's also one of the wonder drugs which can be used in case you have problems similar to those of where we are using Clomiphene. Thanks so much for watching, and if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important updates we make. And if you'd like to have a private chat, a private conversation with me, go to my website www.druthman.com, make an appointment. We shall meet there, we shall chat a way forward for your problems. Thank you. Watch again.
Ask Dr. Othman on Masawa